understanding the signs of mild traumatic brain injury and how a safe return to play progression is conducted. Dr. Mark Harrington, DO and ATC, is a specialist in sports medicine and non-operative orthopedics at Alliance Orthopedics. He is board certified in family medicine with a certificate of added qualifications in sports medicine. Dr. Harrington's special interests encompass all aspects of sports medicine, including injury prevention and rehabilitation, acute and chronic injuries, sports-related concussions, and sports physicals. Additional interests include musculoskeletal ultrasound-guided procedures and diagnostics, as well as the use of orthobiologics to improve the healing of fractures, injured muscles, tendons, and ligaments. For 3 years, Dr. Harrington served as a team physician with the Cleveland Browns as well. What exactly is a concussion, you may ask? A concussion is a type of mild traumatic brain injury caused by a blow to the head that forces the brain to move around quickly within the skull. During this movement, brain cells may be stretched or damaged, resulting in altered functional, chemical, and metabolic behaviors. Although this is typically non-life-threatening, it is a serious condition that needs to be evaluated by a medical professional to prevent incurring further damage. Since concussions don't show up on imaging like X-rays, CT scans, or MRIs, Dr. Harrington relies on patients reporting with signs and symptoms. Typically, he will ask patients to rate their experience with the following on a scale of 0 to 6, with 6 being the most severe. He's going to check out headaches, nausea, vomiting, dizziness, memory problems or confusion, sensitivity to light or noise, changes in mood and behavior or personality. In addition to the above symptoms, Dr. Harrington will likely ask the patient to recall information about the incident or injury in order to further assess the likelihood of concussion. These questions may include cause of injury and force of the blow of the head, loss of consciousness, and if so, for how long, memory loss, seizures, number of previous concussions in the past if there was any. Return to play progression is a 6-step guideline of gradually increased activity during an athlete's return to a sport after a concussion. Each step should be monitored by a certified athletic trainer or coach, and progression should not be quicker than 1 step per 24 hours. In accordance with the New Jersey Department of Health law, athletes require written permission from an appropriate healthcare provider like Dr. Harrington before progressing beyond Step 4. The following are the steps. Step 1. Remain symptom-free for 24 hours without the use of pain medication. Step 2. Light aerobic exercise for 20 minutes, such as stationary biking, jogging, or walking. Step 3. Sport-specific exercises for 30 minutes, such as soccer foot skills, throwing a baseball, or shooting and dribbling a basketball. Step 4. Non-contact training drills for 30 to 45 minutes and/or progressive resistance training. Practice drills that don't put the individual at risk of getting hit in the head. Passing, shooting, footwork drills, or weightlifting are examples of this. Step 5. Full contact training drills. And Step 6 being a return to play in the games that are allowed. Here are some of the most frequently asked questions about concussion recovery. Question 1. When can an athlete return to school or non-sport related activities? Depending on the severity of the injury, typically patients can return to school or work as early as a few days to a week after the injury. As part of the athlete's recovery plan, Dr. Harrington works with patients to create an individualized school plan that consists of recommended accommodations to school attendance, breaks, workloads, testing, physical activity, and visual and auditory stimulation. Question 2. What should I expect during rehabilitation? After sustaining a concussion, your dedicated Alliance Orthopedic team of physical therapists and occupational therapists will treat your injury by guiding you through a safe, personalized recovery program. To help you get better faster, they will coach you through your hands-on care, balance testing, and vision rehabilitation. Question 3. Does one traumatic brain injury put an athlete at future risk for more concussions? While the long-term effects of repeated head impacts are still being studied, someone with a history of repeated mild TBIs may experience longer recovery periods or more severe symptoms with consecutive injuries. At Alliance Orthopedics, our team of physical therapists, athletic trainers, and sports medicine specialists are well-versed in general and sport-specific concussion prevention in order to teach athletes steps that they can take to avoid re-injury. Visit us online at allianceortho.com or give us a call at 201-509-8600 to begin your journey to a pain-free lifestyle with Alliance Orthopedics.